Hello, and welcome to Community Health Watch. I am your host, Curly Nelson, and today we have with us Nathaniel Hezekiah. Nathaniel comes to us from Congressman Meeks's office, and he is a wealth of information. Nathaniel will be talking today again about the Affordable Care Act, so I want you to sit back and listen.
Hi, my name is Nathaniel Hezekiah. I'm here representing on the behalf of Congressman Gregory Meeks' office, and we're having a discussion about the affordable health care, or as some of you may know it as Obamacare. Our office, or Congressman Meeks' office, is available for individuals who have questions about things that I might have said or things that they might hear out in the community. They're always able to reach out to their own congressman. For those who live in southeastern Queens, they're able to reach out to our office. The phone number is 718-725-6000. Now, if you want to get a group of individuals together and you want to come into the office or set up an appointment to come into the office, the congressman is allotted Wednesdays from 2 to 5 p.m. for groups of individuals to come in and get more information, more of the information that I discussed here today at the office. So this is an opportunity for you to ask me any questions. I know that this is on television, this is live on television, and we want to make sure that any questions that you might have, they get answered one way or another. If it's not the individuals at the exchange, it's our office. And if it's not our office, it's the individuals on the exchange. But any questions that you should have, feel free to reach out to our office. The phone number again is 718-725-6000. There's one thing, or a couple of things I want to talk about in regards to seniors. A lot of seniors are curious about how does the exchange work for them? How does the exchange affect them? Or better yet, how does Obamacare affect me? Because the exchange and Obamacare, the exchange is a portion of Obamacare / the Affordable Health Care Act. The exchange is not the entire Affordable Health Care Act or Obamacare. The exchange is only one piece of the Affordable Health Care Act. Seniors who have Medicare do not need to apply on the exchange and should not apply on the exchange. Medicare covers 80% of most of what your costs are. That's if you have Part A, B, and or Medicare Part C, also known as the Medigap, or Part D, which is the prescription drug plans. So individuals who have Medicare do not need to go on the exchange. Those individuals can look for supplementary plans that are offered through Medicare. Supplementary plans that are offered through various other providers. I know one of the big ones that seniors have mentioned is AARP that a couple go to. Not trying to endorse any plan here, but any supplementary plan or complementary plan to Medicare is able for seniors to go on, or they're eligible to go on. Except for the plans on the exchange, seniors should not go on the exchange looking for health coverage. For young people, can't forget about you. You're the most important, or one of the most important groups out there, because your group is kind of the group that goes quiet, or they determine you as the group of individuals who don't have coverage, that are lacking health coverage. And it's important for young individuals to realize that there is a federal law in place that allows your coverage to extend until the age of 26, which is a great thing. It's a great thing. But in New York, specifically in New York, we try to take it to the next level. And with that being said, back in 2009, the New York State Legislature, in conjunction with the governor at that time, Governor Patterson, signed into law age 29. It's a state law that went on the books that allowed individuals to remain on their parents' coverage until the age of 29. You can look up further information about age 29 law on the New York State Department of Health website. I encourage all individuals between the ages of 18 to 29 to go on the New York State Department of Health website and check that information out and see how it could affect you. While for those individuals who have already applied or still are considering if they're going to choose which plans they're going to choose on the exchange, I think one of the important things for you to know is that there are essential benefits that must be provided with every plan that is on the exchange. That was capital or paramount in the negotiations with the state, that these healthcare providers had to have these 10 essential health benefits in order for individuals to sign up to plans that they might have been eligible to. Those benefits include ambulatory patient services, emergency services, hospitalization, maternity and newborn care. Individuals who suffer from mental health issues and diseases, prescription drugs, rehabilitative services, laboratory services, preventative and wellness visits, and chronic disease management. And one of the most important things for pediatric care. And in pediatric care, there's also the option, or not even the option, the mandate that in pediatric care, these young individuals, these toddlers, have oral and vision care provided a part of the essential health benefits. So these are great factors. These are the great essential health benefits that each health plan must have in the state of New York or throughout the entire country. All health plans must have the 10 essential benefits in order for them to be on the exchange. Another thing, it's important for everyone to remember the website, the telephone number, and the navigators. The website, nystateofhealth.ny.gov. Again, nystateofhealth.ny.gov. You can go on there, look to see the plans that are available, get a live assistant to help you out. The telephone number, 855-355-5777. Again, that number is 855-355-5777. Or you can use that 855 number to get a list or some information about navigators in your community so that they can help you with figuring out a health insurance plan that works best for you and your family. It's important for people to know that should you not choose a coverage, should you not choose a coverage on the exchange, or you not have a coverage or plan, a health plan, there is a penalty that individuals and families will pay. For an individual, it will be $95 if you do not have health coverage, or 1% of the total income of the household. For a family, it'll be $95 for each individual above the age of 18. Subsequently, for those individuals under the age of 18, it will be $47.50 for those individuals under the age of 18. Or again, 1% of the total income of the family. Either one of those, whether it be the 95% or the 1% of the total income of the home for an individual, or for a family, the $95 per individual over the age of 18, and $47.50 for all the individuals under the age of 18, and the subsequent 1% of the total income for the home. Either one of those, whether it be the individual numbers or the 1% that is highest, you will actually pay that amount. So if the 1% of the total income for an individual is higher than the $95, they will pay that amount. Same for a family. If the total income or the total amount owed is higher under the 1% piece, the family will pay the 1% piece. So either one that is the highest volume or highest amount, that's the amount that will be paid. Also, there's been a lot of discussion about some health plans coming to an end. In the state of New York, prior to the health exchange, there are 2 existing plans that were available for individuals who did not have coverage or couldn't get coverage on Medicaid. And those plans would be Healthy New York and New York Bridge Plan. Healthy New York was a plan for individuals who, for whatever reason, couldn't get health care through their employer, or if they didn't have an employer, they had an income too high for them to go on to Medicaid, they were able to go on to Healthy New York. And Healthy New York was able to help them find a plan, or the Healthy New York would be their plan, would be their provider, and they would be able to go see the doctors and have all their medical costs covered, or most of their medical costs covered. And this Healthy New York was also for small businesses as well. It was used as a resource for small businesses to offer health insurance to their employees as well. New York Bridge Plan was a plan that was created through the Affordable Health Care Act for individuals who had pre-existing conditions. So if an individual who was born with, let's say, a kidney issue or a heart condition, or suffers from some ailment, that individual who at some point wasn't unable to get coverage because of their pre-existing condition, a condition that they had through no fault of their own, they were able and eligible to get health coverage that helped cover them through the procedures that they might have needed in order to sustain life or to try to sustain some sense of normalcy throughout their life. So these 2 plans, due to the exchange going into effect January 1st, will be coming to an end December 31st. These plans are no longer accepting enrollment. They're closing down as of December 31st. But the benefits that were set up in these 2 plans are already rolled into all of the plans that are available on the health exchange. The important thing here is that to get health insurance. But in order for you to get health insurance, you kind of need some guidance on where to go. So prior to you signing up to the exchange, I think it's important that you speak with your primary care doctor. See what health insurance plans your doctor accepts, because you don't want to run out and get United Care, but your doctor doesn't accept United, your doctor accepts Emblem or another health care plan, and now you've lost your primary care doctor because you went with the wrong plan, even though you thought that this is the plan you wanted, or you assumed that this is the plan you wanted. It's important that you speak to your primary care doctor to see which plans on the exchange they accept. Let's say if you go on the exchange, let's say you talk to your primary care doctor, but you have 2 or 3 specialists that you've also gone to. What's most important is that you talk to your primary care doctor, and if your specialists don't accept the health care plans that are on the exchange or the one that your primary care doctor has referred to you, speak to your primary care doctor about recommendations for specialists who accept the plan that you will most likely choose on the exchange. And if they're unable to do that or unable to provide you with those recommendations, what you then can do is you can contact the plan, the provider themselves, And the provider will more than happily provide that information to you so that you're able to see which specialists are able to assist you with the health coverage that you have. And then the only thing you should have to do then in that term is just ask the specialist to send your information over to your new specialist who will be taking care of you. I think that's one of the important things. For those individuals with families, you want to think of your entire family composition. You want to think of the baby up into yourself, up into the oldest person in the family. And you have to figure out what works in the exchange for your family, taking everyone into consideration. If you choose one plan, you're going to be stuck with this plan for some time. You're going to be stuck with this plan for about a year. So it's important that you make conscious decisions about the plan that you choose while speaking to first your primary care doctor, then speaking with your family about the options that are available, and then finally making that decision. If you have further concerns, if you have any concerns, let's say after speaking to your doctor and speaking to your family, there are more questions. There's no question that you have that should go unanswered. You should feel comfortable asking any question, because ultimately the end result is the health insurance is provided to help you. There's no other reason why this health insurance is available through the exchange than to help you as the individual or family that does not have health insurance. Call the 800 number, the 855 number, 855-355-5777. You can go on the website, nystateofhealth.ny.gov, and speak to the live assistant while you're there on the site, and they will respond back to any question that you may have. Or you can use the 855 number to go to a local navigator's office or schedule an appointment with a local navigator so that you may be able to speak to a navigator face-to-face, explain to them your situation so that they can best guide you or best present all of the information available to you about the plans that you select and the costs associated with them. I think these are the most important keys that kind of need to be utilized in order to feel comfortable selecting a plan. It's about comfortability as well in selecting a plan. As the country's moved forward into the exchange, we're now a couple of months into the exchange with it open enrollment beginning October 1st, and there have been several hundreds of individuals who have already enrolled into New York State of Health. There are individuals who do not live in the state of New York and they go on the healthcare.gov website. I do not want individuals to go on the the healthcare.gov website. I understand that if you do go onto the healthcare.gov website, it will instantaneously direct you. You go on the website, it says, what state are you from? You put New York, it will direct you to the New York State of Health website. So, in order to circumvent that one step, go directly to the New York State of Health, newyorkstateofhealth.ny.gov to avoid going to healthcare.gov. It'll help you tremendously moving forward. For those individuals who didn't always feel comfortable sending their information through the mail or having to wait through that long line at the Medicaid office, you can now go online through the nystateofhealth.ny.gov website and actually apply for Medicaid. I think this is tremendous help for individuals who are not able to leave their homes. There are individuals who unfortunately are homebound. I think this is essential, that you do go onto the exchange. If you're not eligible if you have Medicare and you're able to get Medicaid online, or you have to renew your Medicaid, you can go online and you can do that as well. But for those individuals who have Medicaid, you can go onto the website and register for Medicaid, re-enroll for some individuals who need to re-enroll for this year, you can receive Medicaid through the New York State Exchange website or by contacting the 855-355-5777 number. And all this is here, all this is benefits of the Affordable Care Act. I know the Obamacare and Affordable Care Act, they might be said differently. People might receive Obamacare differently than they receive Affordable Health Care Act, but they're the same thing. And what the goal in both of these, or the goal in what this program is or what this law is to help individuals who do not have health coverage receive the health coverage that they so desperately need. And with them receiving this coverage, it helps keeps hospitals open. It does that. Individuals from sometimes go to the hospital and unable to pay these medical bills that they incur because they don't have the coverage. And with the coverage and with the debt mounting up with these hospitals because they're not receiving these payments from either the individual who doesn't have health coverage or the little bit of payments that they are receiving, it's not much to cover the entire cost of what a procedure might have been. Having health insurance prevents that. Having health insurance definitely prevents that. And for those individuals who say, I'm healthy all the time, I'm healthy all the time, that's fine. But if you choose not to get health insurance and something mistakenly happens to you, you get sick, you get a cold or something, and it's a cold that won't go away, eventually at some point you'll say to yourself, you have to go to the doctor to see what this is. And to go to the doctor now and you go in for a few minutes, 5 to 10 minutes, and you sit with the doctor and he writes you this prescription, and then they send you this $200 bill for seeing the doctor for 15 minutes, and then you got to pay another $100 so that you can pay off, so that you can pay for the prescription. That's $300 you already spent. But let's say you got a plan through the exchange. You got a plan through the exchange, you pay, let's say you have a copay with your plan, you pay a $10 copay, and then you pay $20 for the prescription drug that your doctor recommended, and then you save yourself 10 times less with a plan than you would on your own because you're healthy. So with a plan you paid $30. Without a plan, you paid an estimate of about $300. These plans, the Affordable Health Care Act, is for you. It's for you, for you, for you, for you as individuals to save, to help you save on your cost of care. It's important. It's important that you check out the website if you can. nystateofhealth.ny.gov. If you can't go online, or if you're uncomfortable with going online, call the phone number, 855-355-5777. If that doesn't work, or if you're uncomfortable with that, call the 855 number and get a list of the navigators in your community so that you can go to one of their buildings or one of their facilities, speak to someone face to face so that you get the information you need to apply on the exchange. Lastly, if you have any questions about anything I said today, if you want to present any new information that you think I should know or incorporate in anything, feel free to give the office of Congressman Meeks a call. The phone number is 718-725-6000. Again, that number is 718-725-6000. The office is there to help its constituents, just as several other elected officials in the borough of Queens and throughout the state of New York are here and able to help the constituents of the state of New York get the insurance that they need and the coverage that they can afford. Thank you.
Thank you again for watching Community Health Watch.